This morning, fears about the Ebola outbreak are growing as cases in the Democratic Republic of Congo are surging, surpassing 1,000.
Communities are afraid. People are dying. They are looking for support. There are a lot of rumors that are circulating, infodemic everywhere.
The WHO is expanding its outreach, sharing information about how the virus is spread. We're raising awareness to prevent the worst, this woman says, carrying a megaphone through this refugee camp. But how are we supposed to protect ourselves, another woman asks. We don't even have soap. As the international response ramps up, the New York Times reports the Trump administration plans to send Americans exposed to Ebola to Kenya rather than bringing them back to the U.S., citing 3 people with knowledge of the plans. The Times reporting that public health service officers are now being trained to deploy to Kenya. In past Ebola outbreaks, like back in 2014, infected Americans were flown home for treatment in specialized medical units. During that outbreak, some patients were treated at the same Nebraska facility now monitoring Americans exposed to hantavirus on a cruise ship earlier this month. The U.S. has already evacuated 2 American doctors from the DRC to Europe. Dr. Patrick LaRochelle, who was flown to Prague, told The Washington Post he speaks with his colleague Dr. Peter Stafford regularly, who's receiving treatment in Berlin, and adds he's doing, quote, a lot better. Dr. LaRochelle, who's still asymptomatic, also said he felt proud to be an American when he was safely evacuated, adding what hurts is knowing that is not available to the vast majority of people, and certainly not to my friends in Congo.
Okay, more to come there, but the breaking news out of Uganda and Congo this morning, the border officially closed between those 2 countries as they try to prevent even more spread there in Africa.